Okay, this is my empty rubric. Front, back, front, back, front, and back. I'm gonna set it face down on this table. All right. Hello.
Hi.
My name's Alyssa Harwood, and I'm gonna be your student nurse today from Saginaw Valley State University. How are you doing?
I'm good. How are you?
Good. Can I get your name and date of birth?
Macy Sifta, 09/11/06.
All right. And do you know where we're at?
Saginaw Valley,
And do you know what year it is?
2026.
All right. You are A now times 3, so I feel comfortable proceeding. We are just going to do a head to toe assessment today. So basically, what that is reviewing your systems from your head to your toe. Are you okay with that?
Yes.
All right. And before we begin the assessment, I'm going to ask you a few health history questions. So answer with honesty. Do you have any allergies?
No.
Do you have any past or current medical diagnosis?
No.
Have you ever had any surgical procedures?
No.
Any family medical history?
No.
And what does your diet look like?
3 meals a day.
All right, fruits, veggies,
Yes.
carbohydrates, proteins, all of that. Do you take any medications, including over-the-counter or herbal supplements?
No.
All right. And what does your exercise look like?
3 times a week.
Pretty active. Do you do any smoking, including cigarettes, cigars, vaping?
No.
Any drugs or substances?
No.
Any alcohol?
No.
All right. And on a scale of 0 to 10, 0 being no pain, 10 being the most severe pain, what would you rate your pain today?
0.
All right, perfect. Now we're gonna get a set of vitals. Do you have a preferred arm? All right. All right, with the diaphragm and my stethoscope, I'm gonna find your brachial and take your blood pressure. All right, I got 112/72. Does that seem like a normal range for you?
Yes.
All right. Now I'm gonna take your pulse for a minute, your radial pulse. All right, and then I'm gonna test for symmetry on this one. respirations were 14, pulse was 68. Now I'm going to take your temperature. Alright, 97.1, within normal range. Now I'm going to take a look at your nails and your fingers to assess for any clubbing. I don't see any clubbing. Color looks good. I'm going to check your cap refill. Less than 1 second, so I'm not concerned about any perfusion problems. And if I had an SpO2 monitor, I would estimate high 90s to 100%. So now that vitals are done, I'm going to start my assessment. So I'm going to start by inspecting your skin on your arms. Oops. Just taking a look. Some freckles and moles. Any changes with those that you've noticed?
No.
All right. Okay. Other side. Some more freckles. So you have a tattoo. Any irritation with the tattoo?
No.
All right. Everything looks normal there. I'm going to assess muscle tone now. Muscle tone is symmetrical and strong. Now temperature. Temperature is warm. No concern there. I'm going to assess capillary refill one more time. Less than 1 second. So I'm not concerned about any perfusion problems there. I'm now going to assess some range of motion. So do you know how to swim?
Yes.
All right, can you do a swimming motion with this arm for me? And then back. Any problems with that? No. All right, now this side. Any pain or stiffness with that? All right, perfect. Now I'm going to palpate your radial pulses for symmetry. Okay, radial pulses are strong and symmetrical. And now your brachials. Brachial pulse, strong and symmetrical on both sides. And now I'm going to test your range of motion for your wrists. So can you rotate them in circles? Any pain with that?
No.
All right, and now strength. So put your hands out like this and push against my hands. And then push my hands in. And then flip them up. I'm going to push down, you push up. And I'm going to push up, you push down. And then can you squeeze my hands for me? Perfect. And then I'm going to have you I'm going to start by inspecting your face. I'm going to look at symmetry. Symmetry looks good. Any problems with acne? All right. Skin feels good, feels warm, so I'm not worried about that. I'm going to inspect your scalp, but before I do that, any irritation, dryness, or infestations I should be aware of?
No.
All right, perfect. I'm going to start by inspecting the scalp. Alright, no abnormal findings. Alright, nothing abnormal. Now I'm going to palpate your head. Any pain with this?
No.
Alright, I don't feel any bumps, so no concerns there. Now I'm going to palpate your occipital lymph node behind your head. Let me know if there's any pain or tenderness. Any pain?
No.
Alright, now I'm going to go postauricular behind the ear, lymph node. And preauricular. And submandibular. And submental. Cervical chain. And then can you shrug your shoulders forward? Supraclavicular. Okay, I didn't feel any tenderness, so I'm not worried about infection. I'm now gonna test your skin turgor. No tenting, so I'm not worried about dehydration with that. So now I'm going to inspect your ears. I'm going to start on the outer part of your ear, inspecting the outside, behind the ear. Don't see anything abnormal. Now I'm going to pull up and out to look at the ear canal. No redness or irritation. Palpating the pinna. Any pain with that?
No.
I see you have some piercings. Any irritation with those?
No.
All right. And now moving to the other side, inspecting the outside of the ear, behind the ear, and then pulling up and out to look at the canal. No redness or irritation. Palpating the pinna. Any pain with that?
No.
And no problem with your piercings on that side?
No.
All right. Now I'm gonna take a look at your nose. I don't know any deviation on the outside. So do you have any problems breathing?
No.
All right. I'm gonna have you tilt your head up, and I'm gonna give you a pig nose. Nasal mucosa is pink and moist. Your hair distribution is even. No polyps or deviation present. So I'm gonna have you plug one nostril and breathe in and out for me. And then plug the other nostril and breathe in and out. Any problems with that?
No.
All right. Now I'm gonna test cranial nerve number 1, which is olfactory. So I'm gonna have you close your eyes and smell, or tell me what you smell.
Coffee.
Perfect. Cranial nerve number 1 is intact. Now I'm going to take a look at your lips. They look symmetrical, moist, so no concerns there. I'm going to have you open up for me. Oral mucosa is pink and moist, and your teeth look good. When's the last time you went to the dentist?
Last month.
Perfect. Now I'm going to assess cranial nerves number 9 and 10. 9 is glossopharyngeal and 10 is vagus. So I'm going to have you open up, stick out your tongue, and say ah for me. Say ah. All right. Your uvula moved on formation, so cranial nerves number 9 and 10 are intact, and your tonsils did not look inflamed at all. Now I'm going to test cranial nerve number 12, which is hypoglossal. So can you stick out your tongue for me and move it side to side? Perfect. And now I'm going to test cranial nerve number 8, which is vestibular cochlear. So can you hear me right now?
Yes.
Any muffled sounds?
No.
Okay, and then cranial nerve number 5, which is trigeminal. I'm going to have you clench your jaw for me. And unclench it. All right. And then I'm going to do the sensory portion of that trigeminal nerve. So I'm going to have you close your eyes and tell me where you feel the sensation.
My forehead. My left cheek. My right cheek. My nose. My chin.
Perfect. Cranial nerve number 5 is intact. And now I'm going to move on to cranial nerve number 7, which is facial. So I'm going to have you make some faces at me. So can you smile and frown and puff out your cheeks and make an angry face? Perfect. Cranial nerve number 7 is intact. Now cranial nerve number 11, which is accessory. Can you put your shoulders up? Okay, and then look to the side. All right, cranial nerve number 11 is intact. And now I'm going to move on to your eyes. Do you wear contacts or glasses?
No.
Do you see the eye doctor?
Yes.
All right, perfect. I'm going to take a look at your sclera and your conjunctiva first. Can you look up? All right. Sclera looks white, conjunctiva looks pink, so no concerns there. I'm now going to test cranial nerve number 3, which is ocular motor. And I'm also going to test for pearla, so your pupils are equal, round, reactive to light, and accommodate. I'm going to do that by looking for constriction. All right, constriction in both of your pupils were equal. Now I'm going to have you look at the top of my pen light and then look at my hand when I say so. Hand, pen light, hand, pen light. Okay, so your pupils are pearla. Pupils are equal, round, reactive to light, and accommodate. And ocular motor, cranial nerve number 3 is intact. Now I'm going to test cranial nerves number 3, 4, and 6, ocular motor, trochlear, and abducens by doing the 6 cardinal fields of gaze. So I'm going to have you follow my pen light in 6 different fields without moving your head. All right, cranial nerves number 3, 4, and 6 are intact. And I'm just gonna shine this, looking for an even reflection. All right, even reflection with that, so no concerns there. And now I'm going to do a cerebellar function or test on you. So I'm gonna have you do an OK sign, and then touch every finger to your thumb as fast as you can. Perfect. And then I'm gonna have you put your hands on your lap and flip them back and forth as fast as you can. Perfect. And then I'm gonna have you touch your nose and then touch my pen light when I say pen light. So touch your nose and then pen light, nose, pen light, nose, pen light, nose, pen light. Perfect. Cerebellar function looks good. Now I'm going to also take your carotids one at a time with the bell of my stethoscope. Before I do that though, I'm going to inspect your trachea and your swallowing. So can you swallow for me? Everything was normal there. Any pain with that? No. And your accessory muscles are not being used to breathe. So now I'm going to also take your carotids with the bell of my stethoscope. I'm going to be on this side. Oops. Hold your breath for me. All right, no breweries noted there. And now this side. All right, and no breweries noted there. So now I'm gonna palpate your carotids. One at a time. My other hand is over here. Strong pulse on that side, and then on this one. Strong pulse on that side. And now I'm gonna palpate your sinuses to let me know if there's any pain or tenderness with this. So frontal sinus and maxillary sinus. Any pain with that?
No.
All right, and now I'm gonna check my rubric for the first time. All right, I'm gonna put it back face down. All right, and now I'm gonna have you turn around for me so that I can feel for your thyroid. So my hands are gonna come around to your neck, so don't be alarmed. Just gonna have you swallow for me. And then I'm gonna deviate and swallow. And deviate and swallow. Perfect. I didn't feel any enlargement on your thyroid, so all good there. Is it okay if I expose your back?
Yes.
All right. All right, I'm just gonna inspect the skin on your back. Temperature feels warm. Spine is in alignment. Just a few moles. Have you noticed any changes with those? Do they give you any problems?
No.
All right. Spine's alignment. Scapula. Can you shrug your shoulders back for me? Just feeling where your scapula is. All right. And now I'm gonna assess AP ratio. So, all right, your ratio is a 2-to-1, so no barrel chest noted. And now I'm gonna have you take a deep breath in for me. And one more time. All right, so I'll stop my assessment around right here. I'm now gonna listen to your lung sounds. So I'm gonna have you take quite a few deep breaths. If you need a break at all, just raise your hand. Listening with my diaphragm. right, your lung sounds were clear. No crackles or anything like that. So now I'm gonna percuss on your back, listening for resonance. Goes. All right, resonance was heard in all fields. So now I'm going to have you lay down for me. All right, and I'm gonna have you scoot down a little bit. I'm gonna take this pillow away from you and assess for jugular vein distension. So I'm gonna have you look towards the wall for me and towards me. All right, no jugular vein distension present. If you did have it present, I would raise the bed to 45 degrees, and if you still had it, then I'd be concerned for fluid volume overload, but you did not have that, so I'm not concerned. Is it okay if I expose your chest?
Yes.
Okay. Sorry.
It's okay.
All right, so just inspecting the chest, I don't see any abnormal findings with the skin. Temperature feels good. Now I'm going to listen to your heart valves. This is the right side, and this is the left side. Starting on the right side, finding the clavicle, space, rib 1, first intercostal, rib 2, second intercostal. This is the aortic valve, and I'm listening with my diaphragm for lub dub. Lub dub present. Switching to my bell, listening for murmurs. All right, no murmurs present. Moving to the left side, left clavicle, space, rib 1, first intercostal, rib 2, second intercostal. This is the pulmonic valve, using my diaphragm to listen for lub dub. Lub dub present, switching to my bell, listening for murmurs on the pulmonic valve. No murmurs present, switching back to my diaphragm. Third rib, third intercostal. Go right in here. This is Erb's point, listening with my diaphragm for lub dub. Lub dub present. Switching to my bell, listening for murmurs. No murmurs present. Now I'm still on Erb's point, so I'm going to find the fourth rib and then the fourth intercostal. I'm going to go under your brow. Is that okay?
Yeah.
Listening with my diaphragm to the tricuspid valve right here. Lub dub present. Switching to my bell, listening for any murmurs on the tricuspid. And I'm also right here. No murmurs present. Switching to my diaphragm. I'm gonna go clavicle space. Rib 1, first intercostal. Rib 2, second intercostal. Rib 3, third intercostal. Rib 4, fourth intercostal. Rib 5, and fifth intercostal. And then I'm gonna slide my finger over mid-clavicle, listening with my diaphragm. for lub-dub at the mitral valve. Lub-dub present, placing my finger, switching to my bell, listening for murmurs. No murmurs present, switching back to my diaphragm and taking the apical pulse for 1 minute. All right, apical pulse was 67. So now I'm gonna cover you back up. And I'm going to assess your abdomen, so I'm gonna come and pull this up. And I'm gonna have you pull these down. That's good. And I'm gonna start by inspecting. I'm gonna note the temperature. Temperature is warm. Looks symmetrical, nothing's sticking out, poking out. I'm gonna go to the end of the bed and look for the abdominal aorta pulsating. All right, I do note it pulsating, which is completely normal. Inspection looks good. So now I'm going to also take 4 bowel sounds, starting in the right lower quadrant. This is the right, this is the left. I'm gonna use my diaphragm. Right lower quadrant, listening for about 5 vowel sounds. All right, 5 vowel sounds noted. Right upper quadrant. Five vowel sounds noted. Left upper quadrant. Five vowel sounds noted, left lower quadrant. Alright, 5 vowel sounds noted in that quadrant. I'm now going to listen to your arteries with the bell of my stethoscope. I'm going to find the xiphoid process and umbilicus, finding the abdominal artery, aorta, and listening for any bruits. No bruits noted. Moving to the left renal, listening for any bruits. And the right renal, listening for bruits. Alright, no bruits detected. Moving to the iliac. No bruits noted. Moving to the left iliac. There we go. And no bruits noted there. Now I'm gonna percuss your stomach, listening for tympani. I'm I'm going to start in the right lower quadrant. Left upper, left lower. Timpani was found in all quadrants, so now I'm going to percuss up to the liver, and once I hear a dull sound, I know I hit your liver. Alright, so your liver sits about right here. Now I'm gonna start with light palpation. Let me know if there's any pain or tenderness. Starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Any pain or tenderness with any of that?
No.
Now we're going in for deep. Right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Any pain with that?
No.
All right, perfect. Now I am gonna find your femoral artery, so is it okay if I go near your groin?
Yes.
All right. I'm gonna start by palpating the right femoral, and I am right here. Strong pulse there. Left femoral. And I am right here. All right, strong pulse. Now I'm going to auscultate with the bell of my stethoscope. Listening for breeze. And I'm right here. Alright, no breeze detected. And I'm right here. And no breeze detected. Now I'm going to palpate for symmetry. All right, strong and symmetrical femoral pulse. So I'm going to move down to your legs. I'm going to assess the skin on your legs, noting the temperature. Temperature is warm. I don't see any signs of edema. Just a few freckles, few moles, but no problems with those, no lesions. All right, and I'm gonna assess your feet. And in between your toes. All right. And now I'm going to assess capillary refill on your toes. I'm going to do it at the top of your toe because you have nail polish on. Okay, comes back within 3 seconds, so I'm not worried about any perfusion problems. Now I'm going to feel for your popliteal pulse. I'm going to have you slightly bend your knees. Find your popliteal. Strong and symmetrical. Now posterior tibialis. Strong and symmetrical. And then dorsalis pedis. Strong and symmetrical. Now I'm going to do a sensation test on you. You can straighten your legs. This is sharp, and this is dull. I'm going to have you close your eyes, and tell me if it's sharp or dull and where it's located.
Sharp on left thigh. Dull on right thigh. Sharp on right knee. Dull on left knee. Sharp on left shin. Sharp on right shin. Dull on right foot. Dull on left foot. Dull on right foot. Dull on left foot.
Right? You got all those correct, so I'm not worried about any sensation there. And did all of that. All right, I'm gonna have you sit up for me now. And I'm gonna test your patellar reflex. Close your eyes for me. Right. The other one. There. Perfect. Now I'm gonna test your range of motion. So can you rotate your ankles in circles for me? Perfect. And then I'm gonna test your strength. So can you push up on my hands? And push down. And push out. And push in. All right, strength is good and symmetrical. Now I'm gonna test just some more range of motion. So can you kick this knee out for me? And down. And out. And down. And both. And down. Any pain with that?
No.
All right, perfect. Now I'm going to have you put your socks on, your shoes. All right, and then your shoes. And then are you feeling dizzy at all right now?
No.
Okay, perfect. I'm gonna have you stand out for me. And let's take a step forward. Shoulder, your feet shoulder width apart. Arms slightly away from your sides. And I'm gonna have you close your eyes for 10 seconds. All right, you can open them. Your Romberg test was negative, so I feel comfortable walking you. I am gonna tie this real quick. All right, so now I'm gonna have you walk to this side of the room. And then turn around for me. And can you walk heel to toe back? All right, you can go ahead and sit down. Any problems with that?
No.
All right. Based on our conversation earlier about your diet and exercise, I have no concern about friction, shear, moisture, so I'd give you a score on the brain scale of 23, which is the highest score you can get, and it means you have no risk for pressure ulcers. Do you have any questions for me?
No.
All right, thank you.